to go to describe this panel and how it would help them get back to work.
Thank you for the question. The panel already exists in current law. When the Health Partnership Program was set up in the early 90s, the law established that every certified managed care organization would have a panel of providers to provide care to injured workers. But there's never been a tool to compel those workers to go to those focused, trained providers. The law as it stands today, as I mentioned, allows the injured worker after that initial emergency room visit to go anywhere he or she chooses within the 68,000 providers that BWC currently has. And what happens is, some of them get to the right doctor, maybe they didn't have very serious injuries, whatever the facts are, but 93% of the time they get back to work within 45 days, so they're having positive outcomes. But 7% of our workers, and on an annual basis, that's something in the 7,000 to 8,000 worker number, enter this middle circle and never reappear. They get lost in the provider network, they get lost in other healthcare issues, and they never reappear. What this bill says is we're going to allow injured workers to continue to choose any certified physician they want out of the box. But after 45 days, when we know the clock is starting to tick against them for ever having a positive outcome, after 45 days, then we're going to ask that they go to the certified provider that already, again, is set up in the law, that their MCO has on site ready to go to help them get a different set of opinions or get a different look at their case and hopefully return them to work.
And what's the sanction that forces them to do that? If they don't, do their payments get cut, or what happens?
If they don't go, they can choose to treat anywhere they want, but they would have to pay for their own care then. As you well know, I think, the BWC system is a complete payment. We pay from $1 for the injured worker's condition. So, again, we would continue to pay as much fully as we want while they continue to see an MCO certified provider.
When does the clock start on the 45 days?
From date of injury. Right.
And you gave the example of the 3 folks who got injured and then were permanently disabled. Is there a common thread as to what happened to them in the system and why they ended up permanently disabled?
I deliberately don't know all the facts on all of them, but the fact is that there are hundreds and hundreds, if not thousands, of examples, and each one has a different fact pattern. I know specifically for the lady who cut her hand on the light bulb. She went to an urgent care facility, got a few stitches in her hand, everybody thought it was fine. In her particular case, the provider had missed a diagnosis and she cut some nerve damage, so she had some other issues. The employer was unsuccessful in getting her back to light duty, so there was an employer side of it. I think she probably had some other health issues in her life, because ultimately she got dependent on pharmaceuticals. She also ended up having a psychological issue that came into her claim, and one thing snowballed after another. In what should have been a very, very simple injury, added all these things because it lingered in our system.
Can you take that example now, apply it to what would happen under these bills?
They would study the injured worker, whether it was her or any other injured worker, and we'd watch. And already the MCOs are watching. They have a responsibility to monitor these claims as time goes along. But once the clock starts to elapse and we get to 30 days, 35 days, 40 days, and the person's not back to work, at that point the MCO, if they're not already, should be contacting Margaret in this case and saying, Margaret, on the 45th day, if you're not back to work, we're going to ask you to come and see one of our certified network of providers. Now, these aren't employer-designated doctors. These aren't, a couple hacks from the, dark side of town. These are people who have been certified, and they're probably going to be the same type of providers that we all already experience in our healthcare plans, no matter who your private healthcare plan is. These are going to be large networks of doctors. And in fact, the bill creates an exception. If there's not a specialist in the network, if the injured worker is living somewhere where there's not certified providers, they'll be exempted out of the requirement. But after Margaret has gone for 45 days and not got back on that simple cut on her hand, then the MCO is going to bring her in and ask that she be treated through this network of providers that they have on hand.
Now, and you're saying that if they don't go into that special group, then the state stops paying for the care.
For the medical care.
medical care. Now, are the workers continuing to get a workers' comp benefit, though, a check?
In some cases, we're not impacting their indemnity payments in this, or are we? I don't think we're impacting in these bills the indemnity payments if they choose not. It's just we wouldn't pay the medical anymore.
It does not affect the workers' comp benefits. It just affects the payment of medical.
Right. I will tell you the bills do contain, though, if workers are refusing to go to medical appointments that their doctors have prescribed, they won't get payment of either type under these bills. I think that's a pretty much common sense idea, that if the Bureau has paid for a doctor to tell them they need to go see a specialist or go to a specific type of treatment and they're not going, at that point they've in effect decided to quit the BWC medical system.
And that's a provision in current law, or that's a provision?
Under current law, their benefits are suspended until they resume. Under this bill, they would forfeit.
They were forfeited, and there's very specific language in the legislation that talks about for good cause. We're not talking about somebody who has multiple issues going on, and because of another issue, they have an inability to continue a treatment plan. We're talking about somebody who has a preference of not improving their position. And so we're talking about for a good cause. And that's how we're bringing in the employee's responsibility to participate. It takes all three systems. It takes the employee, the Bureau of Workers' Compensation, and the employer, along with the provider in that mix, to make everything work right. So if you take away anybody's responsibilities, you've got a system that's not moving forward. We've seen some great examples of that with our Medicaid as we move to managed care and disease management. We've certainly seen it in our private health care. We've done it in our VA programs. We've done it in Medicare. Literally the only publicly funded system that we've not, or privately funded system, that still treats employees and workers and patients like our grandma and grandpa had benefits is the workers' comp system. And so this brings that up and elevates the care.
Sounds like the bills would ultimately reduce the number of providers that an injured worker could go see. And I wonder if that might have caused some problems for injured workers in rural places that might have trouble finding a specialist in the first place. Why is it a good idea to reduce the choice of providers?
I would disagree with that fact. Again, the injured workers can go anywhere they want in that universe of 68,000 providers during their first 45 days. So in no way is this going to be reduced. What it's going to do is after those initial periods have passed, if there are providers who haven't been the appropriate contact for that injured worker, it's going to focus the injured worker into those providers who do have a track record, whether it's occupational medicine or more specialized, who will help them get back to work if they physically can. And I want to acknowledge there are some injured workers who are seriously hurt in the state and will never return. I acknowledge that, everyone does. But we shouldn't be losing the Margarets. We shouldn't be losing the Jameses, who start with very simple injuries that escalate into big problems.
And then carry that one point further, though. If in fact we do see a fall off of some because of decertification or whatever, maybe they just choose not to participate in new rules or new quality measures. If we have the ability to make sure that we're getting better outcomes and we're getting people to work better, then we also have the ability to take those providers that are helping us with better outcomes and getting people back to work and pay them more. So there's actually an ability to see some shared savings, and we've got great examples of that. Just look what we're doing on our Medicaid side, and look how we're being able to pay for performance, so to speak. If you can measure it and improve it, you can fund it. But if we're not measuring it and we can't improve it, all we can do is reduce premium or reduce reimbursements in order to manage the cost of it. So this really has an opportunity to expand our provider list and expand it in a way that's meaningful to getting folks back to work.